Hey guys, this is Dr. Hub. Today we look at the subcenter versus the PHC versus the CHC. So first we will be looking at the HWC subcenter. So here the health level is of the primary, and looking at the population now in plain areas, it is going to be 1 per 50,000, and looking at the hilly or the remote areas, it will be 1 per 3,000. And finally the urban areas, it will be UHWC, that is 1 per 15,000 to 20,000. Now we'll look at the total essential staff. The TEC, that is a TS, that is the total essential staff, the HWC and the SHC 4. So this will include one ASHA, it will include one ASHA. Then looking at the UHWC, this is 6 and it includes one ASHA. Now let's look at the number of beds. The number of beds is nothing but it includes 0. Next we will look at the HWC, the primary health center. This is the PHC. So the health center is nothing but primary, and looking at the plain, it will include 1:30,000. Then when you look at the hilly areas, it includes 1 to 20,000. Then when you look at the urban areas, so urban areas will include 1 to 50,000, as well as 1 per 2 to 5 to 3 lakh. This is in case of polyclinic. Now let's look at the total essential staff. This is required in case of the PHCs. So we look at the TES, that is the total essential staff. So in terms of PHC, it is 12. In terms of UPHC, it is going to be 16. And what about 24/7 PHCs? It will be 23. And the 24/7 the UPHC, this will be 27. And in terms of polyclinic is going to be 22. Now let us look at number of beds. The number of beds is going to be in terms of HWC and the PHC. So here it is going to be 2 HWC UPHC, it will be 2 as day care, and in terms of 24/7 HWC PHC or the UPHC is going to be 6. Next we will look at the community health center to CHC. It is going to be the healthcare level is going to be secondary. So the population now in terms of plain areas, it is going to be 1 per 1,20,000. Next is in terms of the hilly area, it will be 1 per 80,000. And looking at the urban areas, it will be 1 per 5 lakh. 1 per 5 lakh. This is in terms of the metro cities. Next is 1 per 2.5 lakh. And this will be in terms of non-metro cities. Then we look at the TES, that is the total essential staff. So in terms of the non-FRU, the CHC is going to be 32. Next, in terms of the FRU CHC, and this is 52. There are 30 beds. And there are 56, about 50 beds. Then in terms of the FRU UCHC, there will be 50 beds and 72, about 100 beds. Now let's look at this is the total essential staff. Now number of beds. In terms of non-FRU, CHC will be 30, and in terms of FRU CHC, it is going to be 30-50, and in terms of FRU UCHC, it will be 50-100. So here we have used some short forms, that is the HWC stands for the Health and the Wellness Center, and in terms of FRU it is going to be First Referral Unit.